Go ahead, Dr. Court. Dr. Court's muted. He's muted.
How's that?
Okay.
Can you hear me now? Great. Yes. Welcome, everybody, to the Optimal Longevity Series. This is Dr. Court. I am no longer a mute. I am going to read our disclaimer so we can get this party started. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any diseases or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider.
Excellent. Dr. Prasad, could you unmute, please?
There we go. Can you hear me?
Yes. Let me spotlight you, and I will pull up. Dr. Court, I'm going to pull up his credentials, and you can go over those, please.
You know what? I've got them right here, Jet.
Okay.
You know, this is one of my favorite parts, is because I get to introduce you, Dr. Prasad. I'm so grateful. Everyone, Dr. Prasad was a professor at the University of Colorado School of Medicine for more than 30 years. He was the director of vitamin and cancer research. He's also the former president of the International Society of Cancer and Nutrition, and he was personally invited to sit on the Nobel Prize nominating committee for candidates in medicine. Dr. Prasad is also the world's first PhD radiological biologist. Why? Because he finished the 7.5-year program in 3 years to beat everybody else out by 4.5 years. Dr. Prasad was also awarded 7 U.S. patents on micronutrients, and he is the discoverer of the anti-cancer potency of vitamin E succinate, as well as discovering butyric acid, the small fatty acid formed by fermentation of the fibers in the gut, as an anti-cancer agent. Dr. Prasad has authored more than 32 textbooks. In fact, I think you're on your 34th textbook. He has published well over 300 peer-reviewed articles, and he is listed in PubMed more than 450 times. And it is with great honor and respect and admiration that I get to do this every Tuesday night on the Optimal Longevity Series. Welcome, Dr. Prasad.
Thank you. Thank you, Dr. Court. I love your new shirt.
Hi, Dr. Prasad.
Hi.
I have two beautiful ladies hanging out with me today.
Oh, that's good.
I have Mary Sunshine on this side.
Yes.
I have Dr. Victoria, who's a chiropractor who's meeting you for the first time, who works with autistic children.
That's nice to meeting you.
And is so excited to be on this call. She just
no woman
an hour ago.
That's
excellent.
Great.
All right. So Dr. Prasad, tonight's call, I've been, for everybody that's on this call, the Optimal Longevity Series, Dr. Prasad doesn't normally get a heads up on the topic. So he is 88 plus years old, and he has a body of work like no other. But tonight we did share ahead of time the topic, which is going to be CBD and micronutrients, so that we can do a deeper dive on this topic, because I think there's a lot of misunderstanding about CBD isolate and how it can be used with neurodegenerative diseases, and I think full spectrum. But why don't we kick it off tonight and talk a little bit about your paper that you wrote in 2020 on the endocannabinoid system. And what is the endocannabinoid system for everybody that's on this call?
Yeah, like our body has a two defense system against internal or external stressors. One is well known that we all know is antioxidant defense system, and another is least known is the endocannabinoid system. And both have a different function, but in part they also have a, for example, endocannabinoid system also have a weak antioxidant and anti-inflammation activity. But the major difference is that it has a consist of a endocannabinoid receptors, and that has an enormous function, especially for neurological issue, behavior issue. And also it has a what is called a ligand, endogenous ligand, and that is very important. It's called anandamide 1, and second one is 2 capital A, capital 2AG. These two are endogenous lipid ligand, and if they get activated, then they work through the endocannabinoid receptor system. And the job of the endocannabinoid receptor system is to make sure, for example, that serotonin level is sufficient so that you don't get this depression. Dopamine level, make sure it is sufficient so that you feel happy. And also release of glutamate, because that creates also a lot of anxiety, hyperactivity, and these jobs cannot be done by antioxidant. Antioxidant can protect against the toxicity of the glutamate, but it cannot prevent the release of the glutamate. So that is a distinction between the antioxidant and CBD. And therefore, the combination that we have approached is the best one. And so what CBD does, normally to activate receptors, you have to activate first anandamide and 2AG, and they have enzyme. You have to artificially do it. But some of those synthetic ones that can increase the ligand, like anandamide or 2AG, are toxic. But CBD is the only agent which directly activate endocannabinoid receptor system, and then they do their job. Not only that, CBD also have a direct effect on the make sure that, for example, endocannabinoid receptor, R1 is the one which is in neuron, and R2 is mostly in immune cell, peripheral immune system. And so they can stimulate the formation of serotonin so that serotonin level is high. But CBD also acts directly as an inhibitor of serotonin reuptake, because if serotonin gets uptake in the cell, they get metabolized and the level will go down. So some of this function of thing is very unique that cannot be, for example, anxiety disorder. One of the classical treatment, FDA-approved drug, is called inhibitor of serotonin reuptake, and that's what exactly the CBD does, and CBD is non-toxic, but I don't know, So we recommend. That's why we recommend always people who have anxiety, depressions, and it is CBD is a lower dose is very important to take care of that kind of issue in combination with the micro daily, because increased oxidative stress is involved in everything, why you get sick, and so why you get a poor health. And so these are the major distinction. And normally, if you have a smaller stressor in your body, the antioxidant system will increase and endocannabinoid system will enhance their receptor activity and then take care of that. And once the stressor is gone, they go back to a normal level. But in a disease process, this stressor is continuously is high. It's increased oxidative stress, inflammation, and all these things that are associated with the symptom of the disease. And therefore, one approach cannot be important for your optimal health. And that's why we have a core 4 plus CBD, and actually plus also digestive enzyme, that they take care of each defect, cellular defect, that contributes to your poor health.
Can we go to your 2020 paper so we can show people that on?
Sure.
Okay. I love this part. Well, let me see. I need to pull up this. Excellent. I'll move it over. So Dr. Prasad wrote this paper on emerging therapeutic potential. Oops, this is not your paper.
That's not my paper.
This is your paper.
Yeah.
Okay. Dr. Prasad wrote this paper in 2020. He's way ahead of the curve. And this particular paper is neuroprotection by micronutrients and CBD in neurodegenerative diseases. And for those of you that don't have this is a really excellent overview. But Dr. Prasad, why don't you walk us through this? And you had to learn this endocannabinoid system and just walk us through that research, because that's fairly new for people on this call.
I think so. I think it is very important, because even though endocannabinoid system existed forever in vertebrates and in human, but you will be surprised that it was discovered only in 1990s. And the major why it was discovered, because people were started working about the marijuana, what it causes the brain problem, what is the mechanism of action of marijuana. And so marijuana was responsible for the discovery of the entire endocannabinoid system. So somebody said, oh yeah, there is a CBD receptor, then the whole thing has started. But anyway, you can see that endocannabinoid system consists of anandamide, and one is I always call 2-AG. I can't even pronounce it. Archidonyl glycerol, 2-AG, and receptor, and their respective enzymes, which degrades them and which makes them. And so, and the main function of the endocannabinoid system is through their CB1 and CB2 receptor. CB1 receptor is primarily in the neuron in the brain, and CB2 receptors is peripherally in immune system. So the CBD system is, when they get activated, they also improve your immune function, and by different mechanism than say antioxidant will do that. And so this is very important, and you can see that table 1 will give you some kind of a synthetic and natural. They're all the inhibitor of, for example, this, if you inhibit this enzyme FAAH, that anandamide goes up, and when they goes up, then they activate receptors. If you use MAGL, which is the enzyme which degrades these 2-AG, another ligand, and if you inhibit them, the 2-AG level goes up, and then they activate the receptor. So this is a complex mechanism, but for us to remember that it has many receptors. You can see that it has a receptor for serotonin, for dopamine, many other receptors. So this is very complex mechanism, but for us to know that if you have a depression or anxiety, or for example, in patients with Alzheimer's disease, when they advance the stage, they become irritated, they become very agitated, hallucination. This is true also with Parkinsonism. And there, not only antioxidant, but in a CBD, you can see that neuroprotection by antioxidant and CBD in a neurodegenerative diseases, and not only in Alzheimer, but also in Parkinsonism and possibly other neurological disease as well. Because in all those, this common phenomena is that they have this kind of a defect in neurotransmitter mechanism, And so I think it is a this is another very interesting thing. MicroRNA, these are too complex for right now to discuss it, but I think the most important thing is that the CBD act as you can see, that prevents the release of the glutamate. This is very important, one of the very important functions of CBD. And the difference between a spectra of CBD means it has all the junks which you come with CBD when you isolate from hemp plant. They call it a full spectra. This has everything. But when the study was done, the purified CBD was much more effective. In this case, he was measuring just reduction in inflammation, and found out that CBD at the same dose required much lower dose to inhibit inflammation than a full spectra of CBD. So we maintain that our CBD isolate that we have, which is highly purified, is the best for extraction.
And I think, Dr. Prasad, that's really confusing out there. So people have used different types of CBD
like a CBD
spectrum,
oil,
and they use the word entourage effect, which is pseudoscience.
Yeah.
It has no science to it.
No. I think actually I read that article. These are all commercial. There is no scientific basis. And if you look who funded that, the CBD company who was selling the product funded that project. But still, if you look their own is not true what they're saying, their own paper. And I looked one of them that David sent me. It was published from some scientist from Israel. But in any case, I think ours is the best, and I have studied a lot and isolate. We think that this is the best.
And you also have current research for children that have epilepsy.
Yes.
That's been peer-reviewed and published for epilepsy with the CBD isolate.
Isolate, yeah, and it is what you call 750 milligrams for children.
Wow.
So it has a very important implication in brain. And seizure, as you know, that all kind of neurotransmitters are released, and especially glutamate is one of them that makes you so hyperactive, anxiety, depression, and this can be resolved as well. But if you combine them with antioxidant that we have, then you don't have to use that high dose for the same effect.
So to back up, I want to say this real quick. I was doing some research today, Dr. Prasad, and this is fascinating to me, that they actually found a new hybrid cell in between the glia and the astrocyte. And its job is with the VGLUT, VGLUT, and it actually has to do with glutamate excessive toxicity. And I was like, we just found this cell. And glutamate, excessive glutamate and glutamate toxicity is such an issue when it comes to any neurodegenerative issue out there. Whether we have, like Dr. Victoria, with children with autism, pandas,
or
something,
bipolar depression, all these kind of issues. The neurological issue, they don't have to be there if you use a right approach combination. And some people just use the CBD, say, for example. Yeah, that will good, some good. Some people use micronutrient alone. Well, that will do some good. But how about the intestinal dysbiosis that is contributing to all these disease processes? Intestinal dysbiosis, as you know, is increasing the number of bacteria, harmful bacteria in your gut. Is called intestinal dysbiosis. And so in many diseases, I found out today that even both are independent. In a mouth also, the microorganisms which are a mouth, they are independent to micronutrient, to bacteria that you have in the gut. They don't communicate with each other until there is too much problem that the communication breaks down. So also the intestinal dysbiosis in mouth, like peritonitis, some
Mhm.
disease.
Periodontal disease.
Yeah, peritonitis disease. In that one, and that contributes to neurological, because once they have started producing a toxic chemical like pro-inflammatory cytokine, they can diffuse and affect all organs in the body, including brain. So that has been implicated too, and so this is very important to correct the intestinal dysbiosis. And one and only way you can correct it is by taking a probiotics that we have.
Do you, Dr. Corp, have a question, or do you want me to
No, I have-
pull up the
here,
core form for him?
She has
My
the
Theo has questions, so I'm
Yeah.
just gonna sit back.
Okay,
Yeah.
Dr. Prasad, so I work with a lot of autism children and children on the spectrum. What research is there with CBD and these products that I can give parents? Because educating parents in this is a big part of my job and the way I support the community. Anything that you know of?
I think that I have published a paper on autism. No, but first you have to tell parents that here is the risk factor why your children have things. And then you can say, here is the product that can help to reduce it. There is no clinical study on this issue. FDA approval is not there. So it is, since there is no precise, it is an anecdotal story of many people who have taken it, derive benefit, and they have testified or testimonial. They say that, yeah, it is markedly improved. As a matter of fact, one of the former, who established the Engage Global, he had two sons who has this autism, and there was nothing. And so at that time, we were not even marketing it, So he used to come to my lab here in California, in Novato, California, and pick up the same product, which was meant to send to military, and it was lying right there. He used to come and pick up those products, and then he started giving it to his kids. And they did extremely well within a few months and started getting a better grade. And one of them is Air Force, or some of the others. Such a good job. So I think, it is same that many people don't, or many doctors, I would say, don't try to learn that one approach is not going to be sufficient, because there are the multiple factors. And for example, take omega-3. I mean, omega-3 is essential fatty acid that our body do not make it. And it is absolutely essential for brain function and for all other organ function. It is absolutely essential. But when your body has increased oxidative stress, and that causes our glutamate and other kind of abnormalities, they get oxidized and become non-functional. So if your body has a high oxidative stress and you have some omega-3 in your brain, they will, or any place, they will get oxidized by free radicals, and they are no more doing their job. But if you prevent them by taking micronutrient, then it will be okay. So just taking a probiotics or omega-3 alone might do some transient benefit. But to get a permanent benefit, you also have to have a micronutrient which can protect them from oxidative damage. And so our approach has been very combination, yeah.
So I want to say this, Dr. Victoria, Dr. Prasad does have research for humans, adults, and animals on his patent, but I mean, on his research for the microdaily EMF product.
Yeah,
but
yeah.
you
EMF
asked
part is,
specifically for
of course,
children,
EMF
he
has a lot of
them for
human data.
adults,
Yeah.
right?
It's not only patented, but it has a lot of human data.
And a lot of human research. Yeah.
In terms of reducing oxidative stress and inflammation. Yeah.
But I want to segue real quick from that adult research and patent on the microdaily for the adults. Dr. Prasad has just recently received a patent for the children's gummies. Will you
Yes.
walk us through that? Because I think
Yeah.
that that's really the question, Dr. Victoria.
It
We
is
have
very
adults,
important because,
right?
it is very important
So,
because, yeah, I think Dr. Coat was funny. Is gummy bear. The principle of developing is the same as EMF. But children, you don't need that high dose that you require for adult. And that's why we developed the gummy. But conceptually or philosophically, or the only difference is the dosage of each ingredient is smaller. That because my always goal has been to make sure it is safe. And now many people who are taking this, including my own granddaughter, she never gets sick when he goes to high school. She's in a junior, but she has been taking it since I developed it. Before that, she was taking some kind of vitamin that was available in the marketplace. But this is the best one. And as she mentioned, it's patented. So that for children, say up to 5 to 10 years old, and if they have autism or ADHD, and so they can start with that one for sure. And of course, omegas, the what you call omega 3 is the must. Yeah, is the must.
but
And
Dr. Prasad, can you
yeah.
walk us through how this is special? Because it's hard to there's a lot of nutrition in there, like with the selenium, how you made with pectin and you aired, like how you dry it. That gummy is not just off the shelf.
No,
You
no,
meticulously
gummy.
made this.
Some of those issues are manufacturing issue that I cannot address it. You see what I mean? But the formula, the ingredient, is exactly the same, and it tastes good. Sometimes I will take noontime. Sometimes I will take a couple of them. It tastes good, and kids love it. And so I think it is so important, and so now if the kid has some kind of health issue, the gummy would be good for, especially right now, as you know, respiratory virus is going on, and the one thing you can build is to build up the immune system by providing good diet, healthy diet, and take supplement like for kids like gummy.
And Dr. Prasad, she also was asking about reducing exposure because you are the world's first PhD radiation biologist. How important is reducing exposure and her teaching the parents this?
Yeah, I mean,
adding the nutrients.
because, even, for example, the one case is if you go for, say, for example, CT scan, the doctor will say, don't worry about it, nothing will happen. No long-term effect. But there was a European study, we collaborated, then we gave them the antioxidant part of the micro daily, and they tested it. And they found that if you just one CT scan caused damage enough that you can detect in the peripheral lymphocyte. So after the procedure, CT scan, they took out the blood and counted the DNA damage in the lymphocyte. And they have developed a technique of immunology so that the damaged cell become colored. So you can score visually. And they found that that is extensive amount of damage of lymphocytes. And then when they gave a treatment of antioxidant that we provided them 1 hour before this thing, and then do the same procedure, there was over 55% reduction in DNA damage. But here we also recommended you take it after also. They didn't give after radiation because the old concept is that the radiation damage occurred by free radical produced during the time of exposure. But later on, a friend of mine found out that some of the free radicals, especially organic type of free radicals, live 4 or 5 hours later. Still they are active. So you have to also decrease them. And one way you have to do, you take an additional dose. So if they would have taken additional dose, probably the result would have been much more effective than 55%. So in human, but also Dr. Coate has discovered that the EMF radiation, which has become really a risk factor, because in ionizing radiation, you go once in a while for a diagnostic test. But EMF radiation, you are exposed every day. Can't avoid it. And this has become an unavoidable serious cancer risk, not only cancer, but hypersensitivity. Young women can have a miscarriage and all kind of side effects.
Anxiety, sleep issues.
Anxiety, depression, all kind of problems.
I think it has an effect on all
discovered,
cause mortality.
yeah,
all
and
causes-
so not only acute effect but late effect.
Mhm.
And so what Dr. Cote has discovered is that if you take a micro daily, just micro daily alone, it could be very helpful. It is very helpful in preventing you to suffer from those kind of acute effect and obviously a late effect as well.
I had
I
a
wanna-
quick question,
Dr.
John.
Go ahead, Dr.
Yeah.
Gold.
All right, Dr. Prasad, I just wanted to get this down because she is working with so many autistic kids. But here's my question. So if we're working with children, this is a great start because of the dysbiose. This is a very good idea because the omega is so important and it also helps to fill the endocannabinoid network. This would be a really great idea.
I think so.
Okay, what about this?
The digestive enzyme kids doesn't have that kind of issue, and anything you develop does not affect the digestive enzyme. Intestinal health will be good enough for probiotics.
What about this?
CBD depends upon, CBD could be a small dose, maybe 1 capsule a day could be useful.
But not necessary. What about, oh, there they go. What about this?
No collagen peptide for kids.
All right, there we have it. So for our autistic,
We also had a question. Juliana Decker asked about Brain Boost because I know it's helped her son immensely.
Yeah, for kids don't need that many things. I think it is just the CBD. I mean, those 3 things should be enough.
perfect. That's what we need.
So that's
Thank you.
those are for the building blocks for children.
And I like, doctor, I like to hear once you started doing, if you decide to do it, say after a month or 2 months, meeting like this, I like to hear your report. Was it any good? And if not done, can we do something else, modify it further? Because these are all, you're becoming like a guinea pig because we don't have a well-established clinical data to support it.
For children.
So
we have it for adults.
But what we have
children.
data on children, what we have a data on, what is happening to children, why biochemically, and how we can affect them. These are the main issue. And so I think it is very important to have that kind of things because before all these things developed, micro daily EMF was sufficient to take care of the issue of and if suppose if somebody is giving any medication, some kids are getting. I do not these things do not interact with the medication. So if doctor wants to continue it, but if you get improvement much better, the doctor himself will say you don't need this medication. It has happened to many cases. So, but I like to have a report from you. If you say, for example, 5 or 10 kids, you have treated them, and with this kind of strategy, 5 years or less. And if somebody has, sometimes you have a 10-year, 11, 12 years, and then you can give a half dose of micro daily EMF.
I'm hearing that you're asking these 2 ladies to help us with case studies.
Yes.
Okay, good.
And case study, because she's a doctor. Case study can be published, and you all can be author, and my job would be to write it, and it can be published very easily. There you can give the name of the product, but right now what we publish is I can list the ingredient, but I can't give the dose because it's conflict of interest in publication.
Okay.
Thank you, Dr. Prasad.
I can't even name the product.
Yeah.
Thank
So
you.
I want to go back. Let's talk a little bit more about CBD, but his paper that he wrote back in 2020 was on the multi-micronutrient approach and CBD. So
Yes,
people
CBD,
on this call We
Yeah.
actually, the CBD, so I wrote for people to invite them here. How can CBD help me? So you would have the core four. So we're going to pull the core four up. I want you to go over that, but then let's talk
Sure.
about CBD. If somebody's got pain, if somebody's not
Pain,
sleeping,
yeah. And
right?
yeah,
If somebody has anxiety or heart palpitation,
depression, yeah.
but let's,
Whether you have
let's,
disease or not, suppose you are just having one of those issue, work-related or family-related depressions, have nothing to do with a long-term chronic, this can help you.
it can, and it's safe. So
Yeah,
let's
it is.
pull up
It's
the
totally
core
safe.
four. Let's pull up the
It's
core
totally
four.
safe.
And then I'll answer a couple questions, and then we're going to talk about how can you use the CBD if you have these symptoms. So do you want to walk through both the
Sure.
go ahead and hold up the mic. Let's do the micro daily first. So
Micro daily EMF, as you know,
yes,
this
micro
is
daily EMF right
this
here.
is well tested in human formula, and main job of micro daily is to reduce oxidative stress and inflammation. And oxidative stress and inflammation as the major cause of all human diseases, including cancer. You have to remember that is major cause. Every place is involved. In different, they do different thing for different cell, but it is involved. For example, in cancer, micro daily EMF, the oxidative stress can cause mutation, and then in the end, go a series of mutation and cell can become cancerous. But in Alzheimer's disease, the oxidative stress can increase the production of beta amyloid and also hyperphosphorylation of tau protein. And so microdaily can prevent all those issues and therefore reduce the risk of Alzheimer's progression. And so these are different places. It affects different way. You see what I mean? But microdaily is one of them. Is very patented formula, and it has been well tested in human, in animal, against all kind of a stressor, including radiation.
Research.
So let's pull up the gummy. And so for those people that have children,
Those are younger. The gummy is exactly replica, except for the doses as a smaller that is needed for children. But otherwise, the concept is exactly same.
and for those of that you don't people
And again, you can take it 2 in the morning, 2 in the evening. Sometimes it is non-toxic. So right now, suppose respiratory virus is going on, you can take it 3 in the morning, 3 in the evening.
for prevention, because there's that going on.
Building up your immune system so that you can have a reduced risk of infection.
So this is a patented product for
Yes.
people to understand. Dr. Prasad's multi-micronutrient approach is his body of work. And for him to get a patent on this children's gummy, it means it's unique and novel.
Yes, yeah, because they go through a lot of exam, lot of hassle. It takes 2-3 years before you get it.
It is true. And so for everybody on here, it's a really big deal that Dr. Prasad last week got this patent. And so we're very excited about it. Let's go to the next Core 4 product, Dr.
Real
Cord.
quick, Jen. This is also, Dr. Prasad, how do you feel about this being in some of our nursing homes, and just tell the occupants of the nursing homes that these are gumdrops, and put maybe 12 in a bowl and let them go for it?
That you wouldn't hurt.
No contraindications to any medications, and they're getting all the nutrient value they need?
No, not at all. But nursing home type of places, I think hydro would be the best for them. But if they don't, this is the best substitute because it tastes good.
It does. But it's not the same dose as the adult dose for everybody on
it's the same. No, that's the thing. And especially I would say that nursing home, the best strategy would be for nursing home would be Core 4.
Yes.
Because they all need it. They have bone problem, they have a stomach problem, they have a high oxidative stress problem. So I would say micro daily hydro, because it's easy to drink, tastes good. And then you have a probiotics. Probiotics, that's very interesting. That intestinal dysbiosis occur as you grow older with or without disease, even if you don't have any disease, intestinal dysbiosis occurs. And when that occurs, because the normally beneficial bacteria that you have normally in your gut, they produce a lot of useful chemicals. They will produce certain B vitamin, vitamin K, certain neurotransmitters, and that's very good things to do. And they have also what is called a gut-brain axis, so they communicate with each other. So probiotics is the only way you can reverse the population of bacteria in favor of a beneficial bacteria. Therefore, if for any adult, this is a must.
And you made it. So I've measured fecal testing for years, everyone. And Dr. Prasad's masterfully crafted product has bifido strains, lactobacillus, S. boulardii, bacillus coagulans, okay,
Yes.
that make it protect it from the heat and pH so it can get in. But he also put the food for them called prebiotics. And when you have those two together, the probiotics and the prebiotics, they're called symbiotics.
Yep.
And there are not very many products on the market that actually provide the specific food. So his probiotic is very powerful.
Yeah, it is very powerful because it generates short-chain fatty acid, and one of them is butyric acid, which is a powerful anti-cancer agent. But
That
also
hang on,
acid
that you discovered.
Yeah.
Dr. Prasad discovered it.
I mean, I was a dumb professor. If I would have patented all these products, I would have been rich.
All right.
How is this on the patenting process?
Yes, it is in the patent process. They have been submitted it, and they had a few questions that I answered them. I think it will be within, I would say within 6 months, it should be approved.
Excellent. Should we go to the next product?
What is your next product, Jed?
The Omega.
Omega. Yeah, Omega, I mentioned to you, Omega-3 is so important, vital for your general health, especially for brain. 40% of the fatty acid in your brain is DHA, which is one of the components of omega-3. 40%, because it is involved in receptor making. It is involved in everything in a brain. Membranous is a highly membranous structure, and they played a role in making the brain and protecting the brain, making sure it is functioning correctly.
Why did you decide on the 2-to-1 ratio, and why did you also put other omega-6s in it? Why did you put those in there?
Yeah, because in a ratio, the more you need, a more DHA than you need EPA. And 2-to-1 ratio was done to some clinical study on improving brain function. And so I said, yeah, 2-to-1 looks like very good one. And another function that many people don't know about omega-3, the brain has also glucose metabolism system, like insulin receptor, insulin production. I was not aware, but brain also produces insulin, not from the pancreas insulin, but their own insulin. And they also have insulin receptor. So if you have increased oxidative stress, you will damage the receptor, and the brain becomes insulin resistant. And if you have insulin resistant, you can't use glucose for energy. And reduction in energy is linked to the Alzheimer's disease and many neurological disease. So how do you correct that insulin? Because omega is one of the agents that can directly, this is what insulin does. If insulin is functioning well, that insulin will bind with the receptor and stimulate another molecule called AKT, which is a protein kinase B. And when that gets activated, the message is sent to the glucose transporter 4 or GLUT4 to migrate to the cell surface membrane. Until they migrate it, glucose is not allowed to enter into the cell. So in this case, omega-3 directly activates, even though insulin is totally resistant, activate directly so that they can use glucose, they can allow glucose enter into the cell and use for energy generation. So this is very, very additional important function of omega-3 fatty acid.
Wow. How about the next product, Dr. Court. Hang on, and I've measured omega-3 testing for a long time, and I'm so excited to be able to test this product because we haven't had it very long. And I'm excited about the balance of it, and that you also put some GLA in it as well. So I'm excited to get to measure. Go ahead, Dr. Court.
Yeah, collagen peptide. This actual patent has been issued. Now we have a number.
Woo!
Patent. Yeah,
Woo!
yeah. And actually, one huge company today contacted me that with collagen peptide, and they gave the number of patent. That I'm very excited about this product, and I can help you to market it. Very famous company, big company. So I sent the letter to David Nemelka to take care of the issue. But those kind of other, I don't know that he wants or not want, but I'm not the one who can make decision on those kind of issue. But collagen peptide is very important. Many people had a collagen peptide in the market. It's a $1 billion industry. But when I was researching on this issue, I said, everybody is using it, it has some benefit. And people were deriving and people were buying like mad. And then I said, they don't have an inhibitor because why collagen is degrading in your skin. But collagen is so important. 30% of your total body protein is collagen, 30%. And one of the main functions of collagen is to maintain the structural integrity of all organs, heart, spleen, brain, structure, total organ structure. They can, if you lose them, they become loose, shrink, this kind of stuff. So it's very important. And so collagen, then I said, peptide, you have to have the enzyme which are degrading as you grow older, collagen. And collagenase is one of the enzymes which degrades collagen. And they become increased. And the reason they become increased because your body has a high oxidative stress that causes an increase in collagenase activity, and then you have gradual decline in collagen. So then I said, I have to find out some inhibitor of collagen. And while doing research, I found amla. Amla is also called gooseberry in American, but original name is amla. It is a fruit. In India, it's a very popular fruit. I had in my hometown or home village, we used to have this tree of amla tree, and I used to go and eat all the time. But it is in Ayurvedic medicine, it is recommended for many, many disease purposes. But our interest was inhibitor of collagen. And so then I said, is there any other place we have a inhibitor of collagenase? And they found out white tea extract, not green tea, white tea extract also has a enzyme inhibitor. And they, when you combine them, the study was, they do much more than individually. So we said, okay. So in our product, we added a inhibitor of collagenase, and that's why it is going to be effective. So new collagen they are formed, they will stay there. They won't get degraded. And this is very important. So you will be happier, not only your skin and younger looking person, but also your structure of all your organs will maintain, would not shrink.
So for everybody on here to understand, this is a grass-fed product, okay? And collagen peptides with these enzyme inhibitors that Dr. Prasad found and hyaluronic acid with a patent. There are very few, if any, patented collagens on the market. Yes. That's why we have a patent number. That's why they're knocking on his door, because
it is in my name, so they call me.
It's novel, and it means that it's unique. Okay, it works. It works.
Yeah.
So you're looking younger all the time, Dr. Prasad. You're like almost 89, so we're gonna go with that.
In 1 month, I will be 89.
That's right.
And so 3 days.
Yeah, let's pull up the CBD. And Dr. Prasad, I want for people to understand this product. So this one's 25 milligrams. So if someone had pain right now, okay, sprained ankle, surgery, toothache, whatever the pain is, how would you,
if it is acute pain, There's two kind of pain. You use a chronic pain, then you have acute pain. If you have acute pain, you can go up to 200, 300 milligram per day. You see what I mean? But if you have a chronic pain, you don't require more than 100 milligram of a pain in combination with some other things that you might be doing it, physical therapy and whatever doctor recommends for chronic pain. But this is very important. One of the major function of this CBD is reducing the pain.
Yes. Okay. How about, Dr. Court, how about heart palpitations? Like when you get exposed to EMF or you're out driving, how about the heart palpitations or agitation? How important is this product for you personally?
I think again, because you're nervous, and or upset, that creates a palpitation part. So I think under those kind of situations, even a little, like I said, a higher dose of not only macro daily is important, but also the higher dose, like, you can use 250 milligram short term, without any toxicity.
Excellent. And I want you to know there is a CBD isolate that is actually a medication that medical doctors use for epilepsy or for these symptoms.
Because this is the only probiotic that has been, the CBD has been approved by the FDA to be given to children with epilepsy.
Perfect. So we have a question on here for insomnia. And I also want you to, about sleep issues. How could the Core 4 and the CBD help with sleep issues, Dr. Prasad?
Yeah, sleep issues, suppose if you have insomnia, sleep issue is sometimes you have anxieties, work-related, family-related, relationship-related, Anxiety is the major cause of the sleep disorder. But sometimes, like older people have, I don't know, their body don't produce enough melatonin, say for example, or some younger people, for whatever reasons, they are not producing enough melatonin, and also their serotonin level is low. So in that scenario, for example, you can take just before going to sleep. You are taking all these micronutrients anyway, but despite that, if you have this problem, that just before going to bed, take say 50 milligram of 2 capsule of a CBD and 3 milligram of a melatonin. Because melatonin, when you're older, especially, if you're not being produced enough melatonin, then you have to give it some supplement for melatonin. And this way you will have sleep like a baby.
I want to say also with the Core 4 for people on here with insomnia, we have seen very good results with two scoops of collagen, right? With an extra scoop of collagen, because one of the number one ingredients in there is glycine, the amino acid glycine, and it's a peptide. But there is a lot of research out there for insomnia that 4 grams of glycine, which would be 2 scoops, will help them get a good night's sleep in that building block. So that would be very helpful for people as well, that collagen with adding the CBD in. Dr.
Also this, instead of having that kind of dosage, I mean, that's amino acid, so this is non-toxic. But just logistic of taking, if you want to take it, this is okay with me. But in the end, really, it is for sleeping, you have to have a high level of, because this is anxiety related. You're worried about something. And for that, you must need a serotonin high level in your system. And so you can have a tryptophan, but why to take tryptophan? The same thing, job is done by CBD, then it is okay. So I would say that until you don't get with Core 4 and CBD, and that we suggested, then you can go to alternative method, whatever people suggest, like C. But I think in the beginning, this is what I would suggest, to take it core 4 plus this CBD 2 capsule and melatonin 3 milligram. And melatonin you can buy any place.
Well, and Dr. Prasad, the whole point of with tryptophan should be made in your gut. That's why the
Yeah.
probiotic and the core 4 is
That's right.
put
Yeah, that's
together,
why core
is
4 is
that's
so
where it's
important.
made, right?
Yeah. Because if you have intestinal dysbiosis, it can disturb your sleep too.
Right. And the tryptophan is the building block to make the serotonin,
Right.
and to make the melatonin. And
Yeah.
we also need the B6 from your micronutrient for that to
Yeah.
happen. Right?
Exactly. You are correct.
Yeah, that was a nerdy answer, because I'm thinking, oh, that's the rate limiting step. We've got a couple questions here.
Yes, sure.
But I want people to know that if they have the CBD, it's safe. So it's not in a spectrum. There's not going to be some THC or anything like
kind
that.
of junk. No.
That it is currently approved by the FDA for children with epilepsy, and it's specifically the CBD isolate. And if you have pain, both acute and chronic, it's a great way to go. It's safe. And if you want to learn more, read Dr. Prasad's paper. He did an excellent job explaining why you have to take the multi-micronutrients in the CBD so that you can heal. So let's answer a few of these questions. Some of them I'm just going to answer just a couple of them. Let me see. Let's pull them up here. Oh,
After you pull those up, Jed, I got a question also.
go ahead,
Okay.
Mary, while I'm pulling them up, and ask your question, please.
Okay, Dr. Prasad, what would you suggest for someone who recently had an accident and has several breaks?
So multiple breaks, broken, and this person.
Yeah, their question comes. Yeah, that question comes of faster repair, faster healing process.
Mhm.
Yeah.
So would you suggest more than 2 or 3 of the CBD?
No, I think this is, for example, CBD. Yeah, you can have 2 or 3 capsules CBD if you have a pain, and micro daily hydro would be the best for them, because you need a acute effect, faster healing process, and of course, yeah.
So on things like, so for the micro dailies, what I suggested was micro daily actually 3 times a day. He fell onto a ladder from a high height and broken pelvis, broken femur, lots of injuries. He's been on the product for, well, we could highlight him, Jet, because he actually got up and walked on camera. So
is it okay? Hang on, I'm gonna spotlight him here real quick.
I mean,
Yeah, we can
again,
just spotlight him real quick. Okay,
Okay.
so why don't you tell us about your fall there, and Mike, and just welcome Dr. Prasad. This is Mike Nichols, and he was on a ladder on his last light bulb when he decided to jump off the ladder. Tell us about this, Mike, real quick.
Really quickly, I was like about 15 feet in the air, and the ladder slipped out from underneath me, and I came crashing down on top of it, breaking my hip, femur, my pelvis, my sacrum, and 2 ribs. And when Dr. Court and Mary came to see me, I was really in pain. And I started taking the CBD and the micro from Nancy right before the accident. Like an hour before, that was my first time ever taking that stuff. I was like, okay. But anyway, today,
that's very
2
good.
weeks post, I am literally almost pain-free. I still have trouble getting around, but this stuff is like, hello, where have I been? So, yeah.
Thank you.
Thank you.
So
We
to
suggested today.
Dr. Court, hang on, let's recap. So you
That's
fell
okay.
how many weeks ago?
2.
2 weeks ago.
I had surgery 2 weeks ago this morning.
2 weeks ago, broken pelvis. What else?
So, I mean, again, healing process is so important, in that kind of scenario.
Right.
And so
Suggestion.
what Dr. Court recommended was good for acute situation like yourself, and I'm glad that you are feeling better.
So for the next
Continue to
month,
improve.
yeah, for the next month, Dr. Prasad, I suggested this 3 times a day because it's in the healing process. This 3 times a day.
That's fine.
This just standard. You can do it standard
1 or 2 times a day.
1 or 2 times a day. And then this, when he gets
Collagen,
cranky,
for him, collagen peptide is very important.
yes, 3 times a day.
Okay.
Okay. And then this, when he gets ugly mood swings, which happen around 11 o'clock in the morning. He gets ugly mood swings then, and he gets ugly mood swings before bed. So we suggest this for bedtime and at 11 o'clock ugly mood swing. What do you think of that? Is that a
I think
good,
that's great. That's perfect.
Well,
do
for
better than
everybody-
that?
For everybody on here, this is a, thank you, Dr. Nancy, too. This is Dr. Nancy Nichols, the significant other. She's very, thank goodness she had this in his body right before, and it was available. And now we have the core 4, but the use of the CBD can be help in lieu of that pain medication. So that's going to help his body heal. And so how many, Mike, how many of the CBD do you take?
2 in the morning and 2 in the evening. But I also want to say that I am not on any pain meds at all. None.
Good.
Bravo. And I think that is an excellent for everybody on here. The power of the CBD. This is a big surgery. He's very, very fortunate to be alive.
Yes,
He hit hard. And so you're smiling, Mike, and I'm so happy because I saw you, so that's awesome.
And you will maintain good health. I mean, and just remember it when you are perfect health, whatever time it takes. And when you reduce the dose, you do it gradually, not suddenly.
Right.
That's right.
Yep,
And you have a doctor like Dr. Cord. He will advise you appropriately when to do it and so on.
Well, we have a couple questions, and I just want to answer them. Some of them are a little detailed. Dr. Prasad, they wanted to ask, like they had some questions about, could this help heart inflammation and heart palpitations, and getting back to just the root of it, right? Reducing oxidative stress. Go ahead and say that.
Inflammation. Yeah, I mean, for example, the micro daily EMF that we have it is primarily done for reducing oxidative stress and inflammation, which are the major causes of all your acute or chronic illnesses.
So we have a question here, a comment saying Dr. Prasad's research is compelling and his explanations are correct and precise. I love that. How many gummies is equal to 2 EMF green pills? So if you were an adult, somebody wanted to know how many gummies do they have to take?
I think I've developed so many products I don't remember the exact dose.
Russ
but
said
I would just estimate probably
6. Okay.
that maybe
estimated.
6 to 10.
Right.
I
We have-
can't.
We have
But I
somebody
mean,
asking about
what you want to take is no toxicity. So
right, but to have the equal to the dosage.
well, I think then I have to go and calculate it. You can calculate it
Dr. Court can.
better than I can do, Jonan.
Okay. What about palpitations? And I want to answer this.
Again, palpitation is the symptoms, and the symptoms of anxiety, depression, whatever it is, acute case. And you try, I think core 4 will help, plus the CBD. Yeah.
So Dr. Court can have this heart palpitation when exposed to EMF routers or big cell phones
that's
or
another
driving.
thing is acute. Yeah.
It really helps with that, with his
Yeah.
heart palpitation. So for people on there, that will help. We have a question about, let me see.
There was one about ascorbic acid.
Yeah, Dr. Court, somebody wrote, why is ascorbic acid added to the eye boost? Why did they wanted to know why you put that in the formula?
Because sometimes, some of those things get oxidized, and ascorbic acid in eye boost was added because of prevent the oxidation. of the product so that the shelf life is better. Very
All right.
small amount. It is very small amount.
Okay, so what we wanted to know is, and by the way, we had many people thanking Mike and Dr. Nancy. Thank you. Thank you so much for sharing. That was so helpful. What
Yeah.
people wanted to know about heart inflammation. This is another person, like, this must be, Dr. Prasad has a patent on this formulation for both pulmonary and heart issues. So we've seen this, but a lot of people are very concerned about heart inflammation and heart palpitations, Dr. Prasad.
Yeah, I mean, again, a heart inflammation is no matter where it is. It will be reduced if you take the core 4. And so, and so I think, if it is so I would suggest that, these things I would always say that try for 90 days. And if it helps you, then you do it. Otherwise, forget about it.
We have one last question I'm going to answer here. How about degenerative disc in their neck?
Yeah, I mean, again, there is no human data available, but at least it can what you call reduce. The reason the degeneration of the disc and other things occurs, first, the loss of collagen there and secondly, that oxidative stress could contribute to that. So again, I would suggest that to take and it is a chronic issue, so intestinal dysbiosis must also occur. So I would suggest to take core 4 for 90 days and let us know if it has any improvement, because that can also cause pain in the neck.
Right. And Dr. Cord has used it, I mean, for 8 years in his clinic with TBIs and concussions and major issues. Last question, and I think this is an important one. What can an asthmatic person take this? So people that have lung issues, will this help them?
Well, again, I would say that, is many people who had a lung issue in terms of a lung infection, and they get benefit from, again, when you have any kind of lung infection, they produce a lot of inflammation.
Mm-hmm.
And that causes gradually increase the damage of the lung. And eventually it becomes fibrosis, then you can't breathe nicely. So it is very important to take an early intervention. And again, core 4 would be very useful. Again, try 90 days. And if you feel happy, then, if those symptoms disappears, then continue. Otherwise, don't.
People ask me all the time, how long do I need to take this product? And I say,
days.
well, since 1980 to today, we have a lot more computers than we did in 1980.
Yeah,
and
right.
We're not going to have less computers. We're not going to have less cell phones. We're not going to have less electric fields. It's only going to continue to increase. So I'll never get off the product. And I'm grateful to you, Dr. Prasad.
No, I think especially, that's why I said that EMF have become a serious, unavoidable risk factor.
Probably the most catastrophic health crisis we've ever seen.
Yeah, but the good news is at least we have something we can reduce it.
Yeah, from the inside out.
Yeah.
Proven to protect us from the inside out. But we also need to have the Dr. Victorias and Dr. Nichols and the world educating people to reduce exposure, and that now we have a product with your body of work that it's safe. Right?
I'm worried about the kids. Kids, you can't take away their cell phone. They will she will walk out from your house. So what do you do best? Then at least the kid can have a gummy that tastes good. At least it will reduce the risk, and she will feel better, and she will perform better in the school and everything else.
So we have one comment and I have a couple testimonies too, but about lungs, but we have Sonia Thomas on here. Thank you, Sonia, for commenting. She said, yes, it helped me. I no longer have lung issues due to using micro daily EMF. And I have seen that also personally with Dr. Court's patients as well. So that's very exciting news. But with that, the hour is up. We went over a little bit. Sorry for starting late. Thank you, Dr. Prasad. And
Thank
we
you,
will
thank
not
you.
have a call next week because we're going to be having recognition
Yes,
next Tuesday. So we'll be again live on the 19th
okay,
of December. So you get a break, Dr. Prasad.
good.
You're off next week.
Okay.
But if everybody wants to hop off and just thank Dr. Prasad for his work, they can go ahead and do that. And thank you everyone for the comments and questions. And we'll see you on the 19th.
Okay.
Thank you, Dr. Prasad.
Dr.
Thank you so much.
Dr. Prasad.
Thank you very, very much.
Thank you.
All the best.
Thank
Thank
you,
you,
Dr.
Dr.
Prasad.
Ford.
Bye. Thank you.
very
Appreciate you.
Good night.
You guys
do a good job. Thank you.
Bye-bye.
Let's go.